CNA Practice Test 2026 Certified Nursing Assistant, Full Course Hearing Speech Impaired. Question 1. Which of the following is an example of nonverbal communication? Speaking clearly, writing a note, facial expressions, whispering. Nonverbal communication includes body language, gestures, and expressions. Question 2. A resident is angry and shouting. What should the CNA do? Shout back. Leave the room immediately. Stay calm and listen. Tell them to be quiet. Active listening and remaining calm can help de-escalate the situation. Question 3. How should you communicate with a resident who is hard of hearing? Shout into their ear. Speak slowly and face them. Use high-pitched tones. Avoid talking to them. Facing the person allows them to see your lips and facial cues. Question 4. What is active listening? Listening while doing other tasks. Focusing fully and providing feedback. Interrupting to clarify. Thinking about what to say next. Active listening requires full attention to the speaker's message. Question 5. Which is a barrier to effective communication? Using clear language. Maintaining eye contact. Using medical jargon. Allowing silence. Medical terminology can confuse residents and families. Question 6. A resident's daughter is upset about her mother's care. You should tell her she's wrong. Listen and report her concerns to the nurse. Argue with her. Ignore her. CNAs should validate concerns and refer them to the supervisor. Question 7. When answering the phone at a facility, you should just say hello. Give the name of the unit and your name/title. Ask who is calling before identifying yourself. Hang up if it's not for you. Professional phone etiquette includes identifying the unit and yourself. Question 8. Objective information is what the resident tells you, what you see, hear, feel, or smell. Your opinion, a guess. Objective data, signs, are observable and measurable. Question 9. Subjective information is the resident's blood pressure, the resident's weight, what the resident tells you they feel, a laboratory result. Subjective data, symptoms, are reported by the patient. Question 10. Which of the following encourages communication? Open-ended questions. Yes/no questions. Changing the subject. Looking at your watch. Open-ended questions allow the resident to elaborate. Question 11. If a resident speaks a different language, you should shout. Use an interpreter or communication board. Don't talk to them. Assume they understand English. Effective communication may require specialized tools or services. Question 12. Why is it important to explain a procedure before doing it? To waste time. To get the resident's consent and cooperation. Because the law says so. To show off your knowledge. Explaining reduces anxiety and respects the resident's right to know. Question 13. A resident is crying. The CNA should tell them to cheer up. Ignore it. Ask if they want to talk about it. Leave the room. Acknowledge their feelings and offer support. Question 14. What is the first thing you should do when entering a resident's room? Start the task. Check the ID band. Knock and identify yourself. Turn on the TV. Knocking and identifying yourself respects the resident's privacy and dignity. Question 15. Conflict resolution starts with blaming others, identifying the problem, getting angry, ignoring the person. The first step in solving a conflict is clearly defining the issue. Question 16. Touch can be a form of communication. When should it be used? Always. Never. when appropriate and with the resident's permission, only for medical tasks. Touch can be comforting but must respect personal boundaries and culture. Question 17. Nonverbal communication is often less reliable than words, more reliable than words, unimportant, not used by CNAs. Body language often reveals true feelings even if the words say otherwise. Question 18. When a resident is talking, you should look at the computer, provide feedback and eye contact, check your phone, plan your lunch. Demonstrating interest encourages the resident to express themselves. Question 19. A cliché is a barrier to communication. Which is an example? I'm here to help. It will all be fine. Tell me more. Can you explain that? Clichés minimize the resident's feelings. Question 20. Effective communication with families involves sharing other residents' secrets, maintaining professional boundaries, giving medical advice, complaining about your boss. CNAs must remain professional and protect privacy.